Hello, my name is Dr. Neil Baum from New Orleans. And last week I shared with you an example of how to get onto the first page of Google from my practice. And now I would like to share with you the details of how you can get you and your practice onto the first page of Google. I'd like to begin with a quote from one of the greatest hockey players of all time, Wayne Gretzky, when he was asked, how did you become such a successful hockey player? And he says, I don't skate where the puck is. He said, I skate where the puck is going to be. And I think this applies very well to the concept of getting onto the first page of Google, because that's where your patients are going to be, and that's where they're going to start looking, and that is the first page of Google. It wasn't too long ago that the yellow pages was the way to get recognized by potential patients, but the yellow pages has gone to the same dustbin as ledger cards, and yellow pages are no longer as effective, and many practices aren't even considering advertising in the yellow pages. Google is going to be one of the opportunities for marketing and promoting your practice. But in order to be effective at marketing using social media, you have to be on the first page of the search engines. And I would like to show you how you can easily get onto the first page of Google without a tremendous amount of expense, but does require some energy and effort and your time. So to get started, I recommend begin with blogging. The blogging that software that I use is WordPress. There are other examples of blogging software, but WordPress was very easy to use. It requires a regular posting on WordPress, approximately one article a month, and each article is between 400 and 500 words, which is about a page and a half of double-spaced content material. You can get on to using, or you can use WordPress to get on the first page of Google, and there's just two steps. You create a free account, there's no cost. You enter your content and then publish your content. The whole process in the learning phase takes between 15 and 30 minutes. So number one, you create a new account, and then you give it a name, and the name that you give it will be your name, and no one can have that. Then you add a title, and then you add your content material as shown below, and then you give it the blog a title, and then use your next area below for your content of 400 to 500 words. And then the last step is to hit the publish button, and there is the finished product. And that's how it will look on WordPress. Now, in order to get recognized, I think it's very important that you use catchy titles. This is an example of a title that wasn't very effective and didn't get many viewers. The example was pelvic organ prolapse, and it didn't attract a lot of eyeballs. However, if you write a title thinking like it is a billboard, when you just have a few seconds to capture the attention of the reader, then you will have an effective title. There are tips for writing effective titles. The one that I have found to be the most useful is to try to find a humorous title. So here's an example of a boring title: Incontinence, Diagnosis and Treatment. Wasn't very effective. A little bit better was Incontinence when it gets wet down there. But the one that was the most effective of all was Incontinence: How Not to Depend on Depends. This one attracted more viewers and more people contacting my office for an evaluation than the other two combined. So here are some examples of catchy titles. This is the one that I use, that when things aren't right down there, and then tell what it is, and that's pelvic organ prolapse. Here's another one that worked: A Lark in the Park. They put a correction in your erection. You want to then use your website to connect to your blogs. This is how search engines will find you, by having your blog on your website, and they will be directed from looking at your article or content, and they will take you directly to your website where they can make an appointment or find more information on your practice. So how do you find content? It's really readily available if you just keep looking. An example was a throwaway article I saw in a surgical lounge, and I looked at the table of contents, and it talked about the difficulty or the danger of splitting pills for patients. And so I looked up the article, and they found that tablet splitting could be potentially dangerous. And that was my article: Split hairs, not pills. And it doesn't always have to be a urologic topic. It can be something of what you think would be of interest to your existing patients and potential new patients. You can also use your blog to attract media attention. This was an example of an article I wrote to the Science and Health reporter at the local TV station, and I sent her the blog on pill splitting, and she contacted me back saying that she was very interested in the article and doing a segment on it, and I got approximately 90 seconds or 120 seconds on the nightly news of the local TV station. So in order to be on the first page of Google, there are two areas. One is organic search, which is located on the left, which is the more preferable because you don't pay for that. And then on the right is what is called pay per click. On the left, which is the organic search, there is no requirement of any fee, and show you how effective it can be. If you typed in urology in New Orleans, after about 6 months of blogging, I was on the first page of that Google search. If you typed in prostate cancer New Orleans, I was number 2 after the American Cancer Society. If you typed in vasectomy, I was 1, 2, 3, and 4. If you typed in incontinence in New Orleans, I was number 2 and 3. If you typed in New Orleans impotence, because you want to use words that the patients are going to use, I was number 2 and 3. If you typed in impotence and the zip code where I practice, I was 2 and 3. If you typed in New Orleans and sexually transmitted disease, I'm nowhere to be found. Why? Because I wasn't interested in attracting that condition to my practice. I didn't write any blogs on it, and consequently, I was not using that as a vehicle for attracting patients to my practice for that particular condition. So how effective is it? This was a typical day where I saw 40 patients. 8 were new patients, and of the 8 new patients, 3 came as a result from Google and being on the first page of Google. So in summary, if you aren't on the first page of search results, i.e. Google, then it's likely your site will not get visited. Remember that 75% of users never go to beyond the first page. Second take-home message is remember what Wayne Gretzky said. He skates not to where the puck is, but where the puck is going to be. And your patient puck is going to be on the first page of Google. I hope you have found this information on getting onto the first page of Google useful, and I hope you will give it a try and see how long it takes you to be number 1 on the first page of Google. Because the first page of Google is where the eyeballs of your potential patients are going to look. And if you are on the top, that is number 1 on the first page of Google, you have reached what I consider to be the Holy Grail. If you have any questions or comments, please let me hear from you. If you'd like a white paper on getting onto the top of Google, kindly contact me at the address located on the last slide. Thank you.